Hello, good morning. This is Dr. Vince with the Living Pain-Free Method. And this morning I was driving into my office and I was thinking to myself, after doing a podcast this week that was guided by a fella that is very much into CrossFit, one of the topics that we were discussing was the use of foam rollers to either prepare for exercise or to help get rid of some sort of knee joint pain or ankle issue. Or so he was going through the notion of using a foam roller, and I thought, man, this is a topic on its own. Like, this is a really big deal because the fitness industry has done a great job of bringing into play self-care using foam rollers, rock balls, or trigger point balls, what have you. But let's go over one key principle that needs to be understood, and that's a trigger point, right? These are those tender little buggers, these little knots that you find inside of a muscle that you're chasing or you're smashing or you're hammering or you're just beating the crap out of with your foam roller. Why? You ever wonder? Like, are you doing it because it's the thing to do? Are you doing it because you know that this trigger point is like having a knot in your shoestring and it's a problem? It's a place of weakness in the tissue. So let's go over it really quick, right? A trigger point. A trigger point isn't the whole muscle being tight. It's part of the muscle or a couple of the fibers within the muscle that are tight. We call it taut. So two different things, but we can get into that later. So these fibers are taut, and unfortunately for the whole muscle, they dictate the length of the whole muscle. So if you have a part of the muscle that's taut, but theoretically, the whole muscle is supposed to be this long, right? It's only going to function within the confines of that taut fiber, your trigger point. So classically, yes, trigger points cause joints to not move or glide the right way. They cause a lot of trouble when it comes to pure motion. So yes, absolutely, they need to be gotten after. But the technique that you use to do so is really critical. You don't take a foam roller or a ball or a rolling pin and roll and just consistently, deliberately roll over the tissue. It's a hunt and search. You're using this round object, a foam roller, a ball, to find the trigger point, the tender spot. When you find it, you rest on it. Maybe you put your leg up over the top of the leg that's pressing down on the roller or the ball for some additional pressure, but then you have to relax. The rule is typically 7 to 10 seconds, and then move on. Go find another unhappy spot. Remember the one that you just worked. Come back to it up to 7 times in one single dose. So if you're spending time on the floor doing some foam rolling, you can work the same spot 7 to 10 seconds at a time up to 7 times. There's a couple of neurologic laws at play that say if you abuse this spot too much, you can cause this spot to become tighter. Law of facilitation. So the idea is there's a bit of finesse when it comes to doing trigger point release. And I would tell you that you have to be a little bit mindful. You have to really listen to what the body is telling you as you're doing this. You have to relax, you have to deep breathe, you have to work with that foam roller or trigger point ball in the notion that you're trying to get this hot spot to relax. what you're doing literally is you're putting resistance inside of the electrical line. It feeds back to the brain, and the brain basically down regulates the amount of electricity to that spot. Doing it 7 times, you're slowly ratcheting the amount of amps going to this trigger point. So the idea is you have to slowly ratchet down. You can't just get in it, bang the crap out of it, turn it into nothing, and then think that it's going to be good. Literally, another one of the neurologic laws would say, yep, you're going to get those nociceptors or the pain receptors to fire, right? So now, man, I'm good, I feel good for 4 hours. After that 4 hours, those pain receptors are going to recock. You're going to feel that pain again, probably more. Because now the brain is like, holy crap, I know exactly where the problem spot is. I'm going to send more electricity to it. So now you're kind of making your situation worse. So rule of thumb, 7 to 10 seconds, 7 times for 7 days. Within 7 days of being diligent, 5-minute little bouts on this spot, you should be good. If you have questions about this or things like this is what I do. I'm Dr. Vince with the Living Pain-Free Method. You can reach out, contact me on my website, www.thelivingpainfreemethod.com. I look forward to talking to you.